Hi, this is Dr. Christopher Maloney, naturopathic doctor. I'd like to talk a little bit about stress. I think that the idea that 80% of outpatient visits are involved with stress has been well documented. I think it's actually very close to almost all outpatient visits involve some level of stress. When patients tell me that they have stress or they're just stressed, what I would say to them is that's, again, a garbage can diagnosis. Let's open up that stress and look at different aspects of it and come up with an action plan to address different pieces of the stress so that you can no longer be stressed. I think when patients come in and they've been diagnosed with stress, I find that not terribly useful if they haven't been then told what to do about that stress and how to help it resolve it. For me, in my practice, what I find is that dealing with family situations to the point where I give family members a discount to come in and see me is very effective at dealing with stress. It also helps with dealing with chronic illness because a family member who is causing a great deal of stress can actually cause chronic illness to get worse. And if I deal with the family member and deal with that person's stresses so that the chronically ill person isn't dealing with those stresses, then suddenly I have a twofer. I get an improved stressed person, and then I get the chronic illness that defies all treatment suddenly improves. So I think when we deal with human stress, when we deal with those situations, we do ourselves a disservice if we treat it separately or don't try to treat it within a medical system. As a practitioner, I really try to address stress as at the beginning of a conversation rather than the end.